This video is an overview of the steps taken in preparing tissue samples for light microscopy. This is a view down a microscope of a thin section of kidney. The kidney has been fixed, processed, sectioned and stained to show its cellular structure. If you try to cut a piece of fresh tissue and look at it with the microscope, all that can be seen is a structureless blob. There are several obvious problems. It is not permanent, so the tissue decays. It is difficult to cut sections thin enough to allow light to pass through the section, and it lacks colour. These difficulties are overcome by fixation or preservation, provision of a support medium for the tissue, and staining. To preserve fresh tissue, it is placed in fixative for a length of time suitable for the size of the piece and the type of fixative used. For example, a specimen of this size would be fixed in formalin for approximately 24 hours and then stored in 70% alcohol. The original sample is trimmed, transferred into a labeled plastic cassette, and then into a stainless steel carrier with other labeled samples. The carrier is placed in the automatic tissue processor. In tissue processing, the water in the tissue is replaced with molten paraffin wax. To remove the water, the tissue samples go through increasing strengths of alcohol solutions. The tissue is dehydrated gradually to avoid excessive shrinkage. Paraffin wax is not soluble in alcohol, so after dehydration, the tissue is exposed to a solvent that is miscible with both alcohol and paraffin wax. These solvents, for example xylol, are known as clearing agents because they also make the tissue translucent. This laboratory uses a non-toxic organic solvent, histolene. At the end of the cycle, the specimen is immersed for an hour or more in pots of molten paraffin wax. The next step is blocking the specimen in solid wax. The tissue is removed and orientated as required in a metal mould, which has been filled with molten wax. The base of the cassette with the specimen ID on its side forms a lid for the mould. The mould is topped up with extra wax and placed onto the adjacent cold plate. The wax solidifies and the paraffin block with the specimen is removed from the metal mould. Sections are cut using a rotary microtome. The tissue block is clamped into the microtome. The knife is inserted and clamped into the knife holder. The knife stage is eased towards the block. When final adjustments have been made, the stage is locked in place and the dial set at the required thickness, routinely 5 microns. By rotating the handle, the block is advanced by 5 microns and lowered down past the knife to produce a section. These sections of wax and tissue form a ribbon that can be lifted off the knife and laid down in strips. Due to compression, the tissue sections are slightly wrinkled, but most folds can be removed by floating out the ribbon or individual sections on a warm water bath. Sections are collected up onto a microscope slide and dried in a 40-degree oven overnight. The wax within the tissue sections is dissolved away by the clearing agent. The slides are then rehydrated because the clearing agents are not miscible with the dyes. This stage is simply a series of alcohol washes. The dewaxing and rehydrating steps are referred to as bringing the sections to water. The sections are now ready to be stained. Hematoxylin and eosin are routinely used to stain histological sections. Hematoxylin stains many nuclei a blue to black colour. Eosin stains cytoplasm and intercellular components pink. Sections are overstained in the hematoxylin section. Overstaining with hematoxylin results in many tissue components being coloured blue. The dye is then selectively removed by 1% hydrochloric acid solution until the nuclei can be seen clearly. This process is known as differentiation and is checked with a microscope. Sections are again placed in a weak ammonium solution to produce a deep blue colour. The slides are then stained with eosin. Eosin stains the cytoplasm and most intercellular products, for example collagen, pink, orange and red tones. Once staining is complete, the section is a mixture of purple and pink hues. To make the section permanent, it is dehydrated in absolute alcohol and then cleared in the clearing agent that is miscible with PIX. The clearing agent makes the section translucent. PIX is a synthetic mounting medium and acts as a clear glue-like substance that adheres the cover slip to the stain section. A drop of PIX is placed on the stain section and the glass cover slip is lowered onto it. The PIX will harden after the slide is placed in a 40-degree oven overnight. The mounted PIX has the same refractive index as glass. This means that in the light microscope, light rays are not further distorted as they pass through the section, then the mountant and up through the cover slip. In summary, tissue processing involves fixation, where the tissue is preserved, processing, where water is removed and the tissue is impregnated with wax, section cutting, where a thin section is cut from the paraffin-embedded tissue, and finally, staining, with hematoxin and eosin to give the H&E stained section.